So, good evening everyone. Am I audible and visible? So, welcome to NEET PG PYQ series, Forensic Medicine. Okay, Dr. Ram and Dream Life, Tasmina. Yes, good evening. Good evening all. So, let's start with the PYQs, previous year questions of forensic medicine. So, directly let's start with the question number 1. So, one very important topic in any entrance exam, NEET PG, FMG, any entrance exam is hanging, that is from asphyxial death. So, hanging, strangulation, suffocation, drowning, 4 important topics in asphyxial death: hanging, strangulation, suffocation and drowning. So, this question is from hanging. Okay. So, a case of hanging was brought for autopsy. Autopsy, as you know, autopsy means postmortem examination. So, postmortem examination, an examination, ligature mark present in 1/3 of neck, 1/3 of neck, that is oblique ligature mark. The right eye was open and left eye was closed. So, one eye is open, other eye is closed. Salivary dribbling from the right side of the mouth noted. So, salivary dribbling is a feature of antemortem hanging. So, whenever question asked the feature of antemortem hanging, your answer should be salivary dribbling. Okay. So, salivary dribbling can be a question. What is the cause behind the opening of the right eye? So, here, so this is yes, very good. Sanvi, very good answer. Sanvi answered yes. So, this is Laceration sympathetic. So, this is basically Laceration sympathetic. It is because of the compression of the cervical sympathetic chain. So, the answer is sympathetic chain compression. It is not jugular vein, it is not carotid artery, it is not vagus nerve. So, the best answer is sympathetic chain compression. So, when there is a compression of sympathetic chain on the same side, so that leads to, the pupil is more dilated and eye remains open on the same side. This finding is known as Laceration sympathetic, one of the feature of antemortem hanging. If they ask you in exam, what are the features of antemortem hanging? One is dribbling of saliva, the second one is Laceration sympathetic. Yes, so very good. So, answer is correct. So, I said hanging is very important question. Now, look at this and identify what type of strangulation is this. Let us make it interactive. Okay. So, what we can see here, the victim is compressed at the elbow bend or sometime knee bend. So, what is this known as? What is this known as? Can you answer this? Can you try, all of you? Yes, so this is known as mugging. Mugging, it can be asked in the exam. It is also known as carotid sleeper hold. Carotid sleeper hold. Mugging. So, the cause of death is asphyxia. And one more entrance point here. What is the literal meaning of asphyxia? The literal meaning of asphyxia is pulselessness. Pulselessness. The literal meaning. Generally, asphyxia means hypoxia and hypercapnia. The literal meaning is pulselessness. So anyone, what is the literal meaning of forensic medicine? What is the literal meaning of word forensic? Literal meaning. So this can be asked in upcoming exam. Can anyone answer? Forensic word. It's a Latin word, forensics. The literal meaning. Can anyone answer? So the answer is forum or marketplace. So around Latin days, no, they used to discuss all the civil matter, criminal matter in a marketplace or in a forum. So the forum word forensic, forensis, forensic medicine. Okay, forensic medicine, public place, legal medicine, something related to death. No, it is basically forum. Fine. So, okay, so this is the first question. Now, one more type of strangulation. What type of strangulation is this? Can you identify this type of strangulation? What is this type of strangulation? Look at this. So, this is known as manual strangulation. In manual strangulation, one very commonly asked question is, that is sixpenny bruise. Sixpenny bruise. So, in manual strangulation, you will see sixpenny bruise. So, small hemorrhages, bruises. So, that is caused by the compression of neck by the fingers. Sixpenny bruise. Okay. Yes, throttling, very good, very good. When you answer, that's great. So, the next question from medical jurisprudence, very commonly asked question is perjury. Perjury. So, the perjury means willful giving false evidence, telling lie under oath. So, perjury means willfully, that is with the intention, telling lie under the oath in court of law is known as perjury. So, previously it was defined under section 191 IPC, 191 IPC, punishable under 193 IPC. So, the best answer is 193. But in BNS perjury definition 227 BNS, punishment 229 BNS, 229 BNS. Yes, very good, Sutapa Samantha. So, perjury means basically perjury is a broad term. So, good question. So, the perjury includes any type of willful wrong evidence. Wrong evidence. So, it includes hostile witness plus any documentary evidence. So, it includes anything that is submitted in court of law which is found to be false. So, it can be oral evidence, that is hostile witness, or it can be documentary evidence. So, the perjury is a broad term. It includes hostile witness as well as any other type of evidence. It can be documentary evidence, it can be audio, video, anything that is. Okay. Even medical certificates. So, all of you write in the chat box, perjury is equal to 229 BNS. So write this in chat box. So it can be asked in upcoming exam. 229 is punishment. The punishment is 7 years of imprisonment. Seven years of imprisonment. Perjury is equal to 229. Keep writing. Okay. So one more question can be asked in exam, that is about this BNS. Okay, BNS is Bharatiya Nyaya Samhita. So which is a new code that is going to replace your IPC. So already replaced. So IPC has been replaced by Bharatiya Nyaya Samhita, BNS. And one more, that is BNSS, BNSS, that is Bharatiya Nagarika Suraksha Samhita, that is nothing but CRPC, Criminal Procedure Code. One more new code, that is BSA, that is nothing but IEA, Indian Evidence Act, Bharatiya Saksha Adhiniyama. Okay. So there are three new codes. What are they? BNS, BNSS and BSC. BNS is Bharatiya Nyaya Samhita, that is your IPC. BNSS Bharatiya Saksha, Bharatiya Nagarika Suraksha Samhita. BSA Bharatiya Saksha Adhiniyama, that is nothing but your Indian Evidence Act. Okay. Chalo. Now let's discuss some important BNS that can be asked in your exam. Okay. Yes. So 63, 64, 63 BNS here, 63 BNS and 64 BNS. Can anyone answer what is 63, 64? What is 63, 64? Dreeki, others? 63 definition of rape. 64 punishment for rape. Punishment for rape. So this can be asked in your exam, upcoming exam, because it's an update. Again 64.1 and 64.2. 64.1 general punishment. It's a general punishment. General punishment. 64.2 is custodial rape. Custodial rape. So this can be asked. 64.2 is the punishment that is given to custodial rape offenders. So when rape happens within a custody, it can be police custody or it can be a custody of doctor, then it is punishable under 64.2. So 64.2, that is custodial rape. These two are very important sections. So 63, that is the definition of rape, and the 64, that is the punishment for rape. So general punishment includes any person, any person, one who commits the rape. So it starts with the minimum 10 years of imprisonment to life imprisonment. To life imprisonment. 64.2, that is also same, almost same, 10 years to life. 10 years to life. Okay. Chalo, this is about this. Then this question. In which poisoning gastric lavage can be performed? Yes, can I answer this? Gastric lavage. So gastric lavage So that is done in case of any poisoning, any oral poisoning. So in which poisoning gastric lavage is contraindicated? So basically it is contraindicated in case of corrosive poison, corrosive poisoning. So answer is sulfuric acid. Strychnine is a relative contraindication. Carbolic acid is not a contraindication. Kerosene oil is also relative contraindication. So the best answer is sulfuric acid. In sulfuric acid, death or in poisoning, there are three classical features. Can anyone answer? What is the triad of sulfuric acid poisoning? What are the features in sulfuric acid poisoning? Asked many times. So it is a triad of black tongue, chalky white teeth, plus stomach perforation. Stomach perforation, multiple perforation. So in case of sulfuric acid, it is a fatal acid. The fatal dosage is 5 to 10 ml. So it can lead to multiple stomach perforation. So the stomach become black color mass with a multiple perforation. So there will be black tongue, there will be chalky white teeth and stomach perforation in case of H2SO4 poisoning. In this condition, gastric lavage is contraindicated. So when you do gastric lavage, there can be further complication, there can be further perforation and other complications. That's why. Next question is about the sexual paraphilia. Like the question can be asked about voyeurism, proteiurism, necrophilia, necrophagia. We discussed many times in our classes. So necrophilia, necrophagia and all. Proteiurism. See, proteiurism is nothing but toucherism. So what is the best answer? Obtaining sexual pleasure by wearing clothes of opposite sex is known as transvestism, also known as eonism. So it is not the answer. Desire to seek surgery to become member of opposite sex. So this is also gender identity disorder. Not the answer. Exposures of one's genitals to unsuspecting stranger. This is known as exhibitionism. So the best answer is sexual gratification by rubbing private parts against the another person. It is punishable under 74 BNS. So 74 BNS. You can see there in the picture, there are two pictures are there. It is 74 BNS. Can anyone answer what is this sexual paraphilia and what is the BNS section for that? So in this picture, the person is getting sexual gratification, sexual pleasure by looking at the or by taking the video or the image of the female while using lavatory or the some private act. What is that known as? And what is the BNS section under which that is punishable? Can anyone try? What is that? Anyone? Dr. Ram, Sanvi, Jnanaganga, Sutapa Samanta can answer what is that basically? What is this basically? 77 BNS. Have seen the Drishyam movie? In Drishyam movie, the villain, he record the video of the girl. That is the main, the main offense that is committed by the villain, and villain killed by the mother and the daughter, and then hero, all this you must be knowing. Drishyam movie. Have you seen that movie Drishyam? Peeping Tom. It is known as peeping Tom, voyeurism. Okay. So what is this known as? Peeping Tom voyeurism. Voyeurism. So voyeurism is equal to 77 BNS. 77 BNS. Yes. Now look at this question, very interesting question, extra question and newly framed question. Why secretly installed a hidden camera in the bathroom of his female tenant X? The Y means male. Without her knowledge, the camera captured images of X while she was using bathroom, a place where she had a reasonable expectation of privacy. Y then shared these images with his friends through the messaging app. It is punishable under. So the question can be asked in this manner also. Okay. So what is this basically? Yes, come on, all of you try this. Yes, so this is 77 BNS. 77 BNS. 63 definition of rape. 64 punishment. 301 basically necrophilia. Necrophagia. They're all the extreme cases of sadism. So that is punishable under 301. The sexual act with the dead body punishable under 301 BNS. So this picture basically just to tell you that about the movie Drishyam movie. This is one of the very nice movie. Okay, so in this movie the villain records the video of the daughter. So that is basically a type of voyeurism. Just to say voyeurism is punishable under 77 BNS. That's all, nothing else. Okay, now look at this. There are some types of exhibitionism. Some image based questions. Exhibitionism. So this is asked in one of the exam. This is asked in NEET PG. Can identify what are types of exhibitionism here? Can anyone try? Come on, try. So there are 4 types of exhibitionism. So this is known as the first one, that is intentionally lifting the skirt in public place. That is known as anarisma. Anarisma. This is again a type of exhibitionism, showing buttocks in the public place. That is known as mooning. And this is known as flashing. And this is running naked. That is known as streaking. Streaking. Yes, good. Good. The many they answered correctly. Streaking, running naked, that is running naked. So anarisma is some new terminology here. Anarisma, mooning, flashing and streaking, all are the different types of exhibitionism. Exhibitionism. Now one more question for you from sexual paraphilia. A 29-year-old female brings her boyfriend to couple therapist because she is uncomfortable with his behavior. So basically he is suffering from sexual paraphilia. She found him clutching her feet during the intercourse. Notice that he insists on being able to see her feet while they engage in sexual act. So here it is sexual gratification by looking at the inanimate object. One of the sexual paraphilia, one of the abnormal sexual behavior. It's not the normal sexual behavior. So looking at the feet, he gets the sexual pleasure. Or sometimes some people they get the sexual pleasure by looking at the feminine objects like sari, petticoat and all. Okay. So what is this basically known as? Can anyone try this? Can anyone try? Try. No, it's not masochism. So, masochism is basically taking pain. It is not exhibitionism. Already we discussed there are 4 types: aneurysma, streaking, flashing and all. It is not exhibitionism. So, answer must be between transvestism and fetichism. So, transvestism, as you know, eonism. The eonism means cross dressing. So, the best answer is fetishism. So, the answer is B. So, the answer is B, that is the best answer. Yeah. So, next question from NEET PG, PYQ. Which of the following are seen in identical twin except similar finding in identical twins? So, there can be same DNA, so same VNTR, same DNA fingerprint. Now, try to remember, variable number tandem repeats is the principle of DNA fingerprint. So, blood group can be same, not the answer. DNA fingerprinting can be same. Iris color can be same, but one thing which is different is the fingerprint. Fingerprint is also known as dactylography. It is also known as Galton system. So, fingerprint is not the similar feature in identical twins. C is the answer. Now, here one more question asked, types of fingerprint. Frequently asked in the exam, types of fingerprint. So, there is a picture and ABC. Can you just identify type of fingerprint there? Yes, ABC. Yes, Sanvi. Come on. So, this is basically arch. You can see like this. This is arch. And this is loop. This is hole. So, arch, loop and hole. Very good. So, the most common is loop. The least common is composite. Yes. Now, here there is one more question can be asked. How many delta how many core and delta in loop? Can anyone answer? Core, how many core? Core means curving ridge. Delta means 3 directional meeting points. My question is, how many core in loop and how many delta in loop? I said loop is the most common fingerprint. Least common is composite. My question is, how many core and how many delta in case of loop, and in case of hole, and in case of arch? Can you try? Yes, come on. Yes, very good. The in core, so in loop there is one core and one delta. In hole there are 2 delta. In arch, no core, no delta. no core, no delta. Okay, so this is very good. The first to answer is by Saunik Ghosh. Very good, Saunik Ghosh. So I'm going to write the name of the student, one who answers in my class. Saunik Ghosh. Very good. Keep going. Keep going. Good. Now, next question is about from the child psychiatry and infant abuse, feticide. For battered baby syndrome, which of the following is true? Battered baby, that is nothing but child abuse syndrome. Which of the following is true? Multiple stab wounds are seen? No. Stab wounds are uncommon in case of child abuse. So, there can be abrasion, there can be bruises, there can be lacerations. But stab wounds very rare. Stab wounds basically showing murder. Okay, so murder and some other offences. Syndrome is a result of firearm injury? No. Firearm injury basically homicidal in nature. It can be accidental, it can be suicidal also, but very uncommon with the battered baby syndrome. It occurs due to tendency of the child to fall repeatedly? No. It is not because of the fall. It is because of the abuse, child abuse. So, what would be the best answer? So, it is also known as Caffey syndrome, infantile whiplash syndrome. Good, good. So, what is the best answer then? So, the answer is skin lesions of various ages, various ages. So, the answer is A. Good. So, the first to answer is by I think unknown, by Dr. Debake. Very good, Dr. Debake. Dr. Debake, good, answer is correct. So, battered baby syndrome is common in neglected child, it is common in male child. Okay. So, this is the finding there. What you can see here, there are some bruises are there. So, bruises of different ages. So, this is very simple question, I am going to just skip. Next question. Dead body of a deceased male was brought postmortem examination. His relatives reported that he had a tattoo over his skin which was not found on examination. Which of the following structure would you examine? So, tattoo is one of the method of identification. So, tattoo shows the religion, it shows the nationality, it shows the mental status of the person. So, question is tattoo was there, but it was not found during postmortem examination. Which one you are going to dissect? Skin? No. Definitely you are going to preserve the skin. Arteries? No. Liver? No. So, the best answer is lymph node. Lymph node is the correct answer. One classical case is the shark arm case. Shark arm case. Shark arm case. Okay. So, this is basically lymph node. Good. So, the first to answer by again by Dr. Singarapu Karthik. Karthik, very good. So, good. Chalo. Next question is about the dependence from the toxicology. You know, dependence can be psychological dependence, it can be physical dependence. Physical dependence is very common with the two substances. One is the morphine, second one is alcohol. Psychological dependence is very common with the nicotine, that is nothing but cigarette. So, the best answer is cannabis. No, cannabis there can be psychological dependence, very less physical dependence. Nicotine again there can be psychological dependence but less physical dependence. Bang is nothing but your cannabis. So, bang, ganja and charas, they cause more psychological dependence, less of physical dependence. So, the best answer is heroin. So, heroin is the best answer, heroin, good. So, Karthik, so all answered. Praveen Prasad, good. Dr. Ram, okay. So, answer is basically it is heroin, that is nothing but morphine. Morphine, heroin and all, they cause very severe physical dependence. Now, one more question let me ask you. In case of cannabis poisoning, chronic cannabis poisoning, there is one impulse disorder, impulse of killing people. What is that known as? What is that known as? Come on, try. Let's see who is going to answer. Okay, thank you, Jambal. Thank you. My cephalic index is between 70, 75. I'm Indian, 70, 75. 75 to 75 to 80. I know Mercedes cephalic more than 80 Mongolians. So my cephalic index is 70, 75 Indian. You know cephalic index, breadth divided by length. So that is mine is 70, 75. So yes, okay. Run amok. Okay, good. So answer is run amok. Good. Run amok can be asked. Yes, Coro syndrome. Yes, that is a genital shrinkage syndrome. That is also one of the complication of taking cannabis every day. Yes, good answer. Good. Run amok is the correct answer. Many answered. Yes, good. Next question. Next question, that is from a seminal stain, blood stain, very commonly asked. Either they ask Barberio test, Florence test, acid phosphatase test, Takayama test, Teichmann test. Frequently asked in the exam. Okay, frequently asked. Yes, good. So what is the best answer? So a case of POXO. So a case of POXO, that is a case of rape under various sections of prevention of protection of children from sexual offences, and the patient is having perineal pain and crystals of spermine picrate. Spermine picrate. So whenever question asks spermine picrate, your answer must be no doubt Barberio test. Barberio. So in Barberio you will see yellow needle shaped crystals. In case of Florence, you will see dark brown rhombic crystals. Dark brown rhombic crystal. Dark brown rhombic crystal. Florence. So anyone, what is the finding in Takayama test? Takayama test is a test for blood stain. What is the finding in Takayama test? Takayama. Teichmann. Can anyone answer? Let's make it interactive, okay? Let's see who is going to answer this. Takayama. Let's see who is going to answer this question. Yes, very good. Takayama. Yes, Takayama. I remember Yama Mama. Yama Mama, Pink Mama. Pink Mama, that is pink feathery crystals. Pink feathery crystals. Pink feathery. So Takayama, pink feathery crystals. Teichmann, brown rhombic crystals. Man, Teichmann, man, brown rhombic crystal. Mama, pink feathery crystals. So both are the test for the confirmatory test for the blood stain. So blood stain, Takayama, Teichmann. So Barberio, Florence is basically for seminal stain. Florence, dark brown rhombic crystal. Barberio, you will see yellow needle shaped crystals. Pink Mama, good. Chalo, good answer. Now look at this. So this is the Barberio test. Barberio, in Barberio we use picric acid and HCl. Picric acid and HCl. So that forms yellow needle shaped crystals. So whenever word picric acid, Barberio test. Barberio test. Second, Florence. In Florence we use potassium and iodine. We use potassium and iodine. So there will be formation of choline periiodide. Periiodide. Okay, periiodide. So in case of Florence test, there will be crystals of choline periiodide. So this can be asked in your upcoming exam. So all of you just write in the chat box. Florence is equal to choline periiodide. So write this in chat box. So it can be asked on upcoming days. So it is present in the prostatic secretion. choline present in the prostatic secretion. Spermine, that is present in the seminal vesicles. So, in seminal vesicle, Barberio test. Prostatic secretion, if it is there, then it is basically choline basically. So, all these are screening tests, they are not confirmatory test. Confirmatory test. Yes, good Dr. Ram, good answer, good. Chalo. Next, one more test commonly asked is acid phosphatase. So, acid phosphatase, one of the very commonly used test for seminal stain, especially in case of rape. So, in acid phosphatase, the color will be purple color. So, in acid phosphatase, we use alpha naphthol phosphate solution. When there is a seminal stain, seminal secretion, it can give you purple color. So, acid phosphatase, P for phosphatase, P for purple color. One more very commonly asked question in exam, Lugol's iodine. So, what is the importance of Lugol's iodine? And toluidine blue. Can anyone answer? Let us see who is going to answer. So, one who answer will get 3D chocolate from me. Lugol's iodine in forensic medicine and toluidine blue in forensic medicine. Let us see who is going to answer. Come on guys. Let's see who is going to answer. Okay. Lugol's iodine basically for, good answer. I think first to answer is by Dr. Gulam MBBS. Dr. Gulam, good answer Gulam. So, Lugol's iodine basically for vaginal cell in penile washing or penis washing, vaginal cells. So, they look brown in color, Lugol's iodine. Toluidine blue basically for micro injuries. So, like example, minor injuries over the labia majora, labia minora, hymen, cervix. So, we do apply this toluidine blue. Toluidine blue basically stains the DNA and RNA. So, when there is a rupture of cells, so DNA and RNA that comes out, that is stained by this toluidine blue. So, toluidine blue basically for micro injuries and vaginal cells over the penis or the penile washings are detected by Lugol's iodine. Both are very frequently asked question in your exam. Okay. Fine. So, basically Doxab now CRPC is outdated. Now it is basically BNSS. So, it is basically 52 BNSS and 184 BNSS. 52 basically for accused, 184 basically for victim. So, all of you write this in chat box, this can be asked in the exam. 52 is the medical examination of accused of rape, 184 is examination of victim of rape. So, 52, 184, 52, 184, all of you, you must write in the chat box so that you can make me awake, you can keep yourself awake, you can make class interactive, you can make forensic very, very interesting. Write this. Come on, write this. 52, 184. Dr. Pratiksha, 52, 184. I will tell you one more point now. 194 and 196, CR, that is basically BNSS. This is asked in INICET, last INICET, 194 and 196. 194 is police inquest. So 194 police sub-inspector. 196 is magistrate inquest. Try to memorize this. 194 police investigation, sub-inspector, DYSP, SP. 196 magistrate. Magistrate means executive magistrate, Tashildar, AC, DC, sub-divisional magistrate. So that is basically 196, commonly done in dowry death. So this can be asked. So all of you write in the chat box. 194 police inquest, 196 magistrate inquest. Come on, keep writing this. Keep writing. Pratiksha, everyone, keep writing. Good. Chalo. Next question. The favorite of examiner, Datura. So a man having fun in the garden. Fun. Okay. He passed out abruptly, was taken to hospital. Doctors were told by his friend who was playing with him in the garden that he had one of the fruit. So dysuria is there. The patient is having dysuria and restless, irritable. Basically, he is irritable. He is in delirium. So this is basically delirium. Dry heated skin. So basically, it is atropine poisoning. Atropine poisoning or hyoscine poisoning, hyoscyamine poisoning. So all go in favor of Datura poisoning. What is the drug of choice in Datura? Your answer must be physostigmine. Prolidoxime, it is given in OP poison, ruled out. Yellow oleander, cardiac poison, ruled out. Yellow oleander, physostigmine, ruled out. The best answer is Datura. Good. So the first answer is by Karthik. Good answer, Karthik. Good. Now, so this is one frequently asked question. 9D manifestation, that is by Datura stramonium poisoning. Okay, stramonium poisoning. So it consists of atropine, hyoscine and hyoscyamine. So classical content, the very important content is the hyoscine. So there will be dry hot skin, dilated pupil, dilated vessel, delirium, dermatitis, there can be rash, dysphagia, diplopia, delusions. Okay, it is also known as Jimson weed, angel's trumpet, thorn apple, devil's trumpet, Jimson weed, loco weed, all this. Basically, it's a road poison. So this is Datura. So drug of choice is physostigmine. Physostigmine. So the answer is B. Correct. What is the fatal dosage? Can anyone answer? What is the fatal dosage? Can anyone answer fatal dosage? So let me discuss this in detail. Fatal dosage of ricin. What is the fatal dosage? Fatal dosage of Datura. And one more, fatal dosage of strychnine. Can anyone answer? So fatal dosage of Datura 100, ricin 10, strychnine 1. So you can remember like this: 1, 10, 100. 1, 10, 100 in toxicology. 1 is for Naxomica, 10 is for castor plant, and 100 is for your thorn apple. So thorn apple. Okay, fine. So the next question is from mechanical injuries. In mechanical injuries, the important topics are abrasion, bruise, laceration, stab wound and incised wound. Identify the lesion. If you see the lesion there, the lesion is seen over the face and bony prominence, basically over the bony prominence. It looks like incised wound. Face and incised wound. So it must be inside looking laceration. ill. So the answer is incised looking laceration. So Shivam Garg, good. Good. Chalo. So answer is D. Avulse laceration. In avulse laceration, you will see flaying. So there can be flaying, there can be amputation. So there can be other symptoms in avulse laceration. Avulsion. Avulsion characterized by detachment basically. Detachment of tissues from the underlying. So it can be flaying, so it can be amputation. Incised wound. So incised wound is caused by sharp object. So the margins are sharp. So margins are sharp. Laceration looking incised wound. Can anyone answer what is the site of laceration looking incised wound? This is the question, can be asked in upcoming exam. Laceration looking incised wound. Very interesting question. Incised wound looks like a lacerated wound. Incised wound is caused by sharp weapon, but it looks like laceration which is classically caused by blunt weapon. Can anyone answer? C. Shivam Garg, very good. Shivam. So it is the axilla and the scrotum. Axilla and scrotum. So scalp, no, scalp we see inside looking laceration. So my question, laceration looking incised wound. In scrotum we have dartos muscle. So dartos muscle, that makes the area, that makes the margins irregular, dartos. In axilla we have platysma, that makes the margins irregular. Irregular margin, laceration. Regular margin, incised wound. So try to remember inside looking laceration over the bony prominences, not only the scalp. So over the iliac crest, over the femur, over the tibia, fibula, any bony prominence, medial malleolus. Okay. If they ask you laceration looking incised wound, your answer must be axilla and scrotum. Okay. Good. Chalo. Next question. Next question is from heat stroke. One of the favorite question asked in the exam. Heat stroke, sunstroke, so and all. So what is the best answer for this question? Which of the following is most unlikely to present? Unlikely in case of heat stroke. Heat stroke. Hot skin, yes, there can be. Hypotension, yes, because of the vasodilation. Disorientation, yes, because of the involvement of the higher centers. So the answer is sweating. So sweating is absent in heat stroke. Okay, so the answer is basically it is C. Yeah. So next question from toxicology asked in your NEET PG exam. So whenever you see white color powder, it must be white lady, cocaine. Okay, so this is cocaine basically. White lady. So what are the features of cocaine poisoning except is the question asked. Opposition. So opposition. So it's a case of drug abuse. So options are myocardial ischemia, bradycardia, hyperthermia, agitation. So there can be agitation, yes. Hyperthermia, yes. MI can be there, but bradycardia, no. Bradycardia. Now one more question can be asked in upcoming exam in cocaine poison is scratch mark. In case of cocaine poisoning, there can be scratch mark all over the body like this and all. So why scratch mark and what is the reason behind that? What is the funda behind that? Scratch mark in case of cocaine poison like this, scratch mark. Tactile hallucination. What is that known as? Can anyone answer? Yes, very good. That is known as cocaine bugs. Cocaine bugs. Also known as Magnan symptom. Magnum symptom. Frequently asked. Cocaine. Okay. And in cocaine poisoning, we use amyl nitrate. In cocaine poisoning, there will be nasal septum perforation. Very common finding. Nasal septum perforation because of the vasoconstriction. So cocaine inhibits the uptake of norepinephrine transporter. So that increases norepinephrine level, that causes hyperthermia, increased heart rate, there can be heart attack and all. So cocaine, I remember Diego Maradona, one of the famous football player, who was suffering from cocaine abuse. So it can cause high dependence as well. Jet black tongue, very good. Jet black tongue, that can be seen in case of cocaine poisoning. Very good, Dr. Devaki. So this is what I was discussing. This is a tactile hallucination that is seen in case of Magnum symptom, that is nothing but formication, that is in cocaine poisoning. So can anyone answer what is Mickey Finn? Mickey Finn can be asked in exam. What is dry wine? One liners, Mickey Finn and dry wine. Mickey Finn and dry wine. Yes, Mickey Finn is, what is Mickey Finn? Okay, dry wine is chloral hydrate. Chloral hydrate. It is mixed with the alcohol to increase the effectiveness of alcohol. Okay. So my question is, what is Mickey Finn? Mickey Finn. So drink laced substance. Okay, that is fine. Mickey Finn. Mickey Finn. So hot shot. What is hot shot? What is Mickey Finn? Try to find out. This can be asked in upcoming exam. Dry wine. Okay. Yes. Now the next question is from drowning. So I said drowning is very commonly asked question, either seawater drowning or freshwater drowning. So here is the washerwoman hand. So what you can see here, bleached appearance. Okay, bleached, soddening appearance, soddening and bleaching. You can see there, soddening and bleaching. This image you can make out here. So this image you can make out. So this finding, classically known as washerwoman hand. It is non-specific. It can be seen in other than case of drowning. So it can be seen in hypothermia as well. So washerwoman hand is a feature of drowning, and depending upon the washerwoman hand, you can also give about the time since death. If there is a entire hand involvement, when entire hand is involved, time since death is around 24 hours, or time since in the water, that is around 24 hours. If it is only in the fingers, then it is around 3 to 4 hours. If there is a glow and stalking, when there is separation of skin from underlying dermis, then it can be of around say 3 to 4 days, 3 to 4 days like that. So this is how you can remember washerwoman hand. So it looks like cadaveric spasm as well. So the answer is immersion. Is basically because of inversion. Phalanga is basically torture method. So phalanga, that is beating on the palm and soles. So that is not the answer. So hanging suspension more than 72 hours, no. Qualitative liquefaction, no, that is not the answer. So the answer is, best answer is, it is washerwoman hand and it is a case of drowning. That's all. Okay. Yes. Yes. Good. Now look at this now. So what is this finding there? Can anyone answer? What is the finding in case of drowning? So one of the important finding in drowning. So very important finding is cadaveric spasm. Cadaveric spasm, which is a feature of antemortem drowning. Antemortem drowning. Okay. So, one more important feature is diatom. So, diatoms in the bone marrow and the brain is a feature of antemortem drowning. So, one more feature can be seen in drowning. So, look at this. So, this is froth, fresh leathery froth. So, it is non-specific. It can be seen in OP poison, it can be seen in pulmonary edema, any respiratory condition, it can be seen in some other conditions also. Fine leathery froth, so which is seen in case of drowning, which increases on chest compression, usually at the nostrils and the mouth. So, is one of the common feature in case of drowning. It's a fine leathery froth. Can anyone answer what is the feature of conscious drowning? What is the feature of conscious drowning? Conscious drowning. Let's see who is going to answer. Conscious drowning and unconscious drowning. Unconscious drowning. Let's see who is going to answer this. Let's see who is going to answer this. Come on, try this. Try. In conscious drowning, you will see emphysema aquosum. Unconscious drowning, you will see edema aquosum. So, this can be asked in the exam. Guys. Okay. So, two important finding. Emphysema means dilated alveoli, there is a rupture of alveoli. So, because of the breathing effort, so there can be break in the continuity of the alveoli, that is known as emphysema aquosum. So, here there will be lot of froth in emphysema aquosum. In edema aquosum, there will be less froth, very minimal froth. So, this is known as watery lung. So, in case of unconscious drowning, so or in case of post-mortem suspension of body in the water, there can be edema aquosum. But emphysema aquosum, frothy lung is a feature of ante-mortem drowning. So, let me discuss three important features. Ante-mortem hanging, salivary dribbling. Ante-mortem drowning, cadaveric spasm. Ante-mortem bone injury, soot particles in the larynx, trachea and the lungs. Three important questions, very commonly asked. Very commonly asked. Yes, guys. Yes, all of you, Doksab, Shivam Garg, Shaurya Gupta. Are you enjoying the forensic class? How is the Josh in forensic class? Are you enjoying it or is it very boring? Be very frank, guys. So, we are discussing lot of image based questions as well in between PYQs. Okay. And also BNS here there. I said 63 definition of rape, 64 punishment for rape, 64 2 punishment for custodial rape, 77 voyeurism, okay, 74 proteurism, 194 BNSS police inquest, 196 BNSS magistrate inquest. Okay, yes. Enjoying? Hi, good, yes, fine. Chalo. So, shall I sing a song for you? If you want, so that you can make class interactive. So, I can sing a song for you in Kannada, not in Hindi, not in English, in Kannada. If you want, I can sing a song for you. I can make you happy there. Are you ready? Batao, Shauryam Gupta, Pratiksha. Okay. ಹಾಡೊಂದು ನಾ ಹಾಡುವೆನು ಹೃದಯ ರಾಗದಲ್ಲಿ, ಕವಿತೆಯನ್ನು ಬರೆಯುವೆನು ಮನದ ಆಳದಲ್ಲಿ, ಹಾಡೊಂದು ನಾ ಹಾಡುವೆನು. Yes, Pratiksha. Okay, hope you liked it. Chalo, next. So, next question is from firearm injury. Firearm, James Bond 007. Firearm injury. Identify the gun that caused the wound and range of the shot. Okay. What is the gun that is used by the James Bond? And what is the range of the shot? Range of the shot. Okay. So, chalo, let's solve this question. So, what we can see here in this image, nice, okay, fine. Yes, fine. So, look at this is entry wound. So, what you can see here, this is entry wound. Entry wound. How it looks basically, this is how it looks. See, look this, it looks like this. Hai na? Like this it looks. So, this is known as, like a sun at the center surrounded by the stars. Okay. Sun, and so this is known as satellite wound. Satellite wound. So, this satellite wound is caused by shotgun. Shotgun. Okay. Shotgun. And look at the size of the entry of the wound. So, it's big. It's bigger than the size of the bullet. So, it looks like a lead ball. So, the lead ball entering into the body. So, cause of death is shock and hemorrhage and death. So, probably around 30-40 meters range or less than that. Shotgun has only less than 30-40 meters. So, satellite wound is there. So, options are there: intermediate range, close range, near range and close shot. So, close shot. So, what is that? So, now here look at this image. If you see here shotgun, so this is the contact wound. You can see contact wound there, which is round. Close range, you will see blackening, tattooing and singeing. So, blackening, singeing and tattooing. In mid range, also known as intermediate range. Mid range means intermediate range, where you will see rat hole appearance sometime, and also surrounded by satellite palette pattern. Satellite palette pattern. In case of distant shot, you will see no central hole and there is only the satellite palette pattern. Look at this now. Now, with this now you can come into the conclusion that it is basically intermediate range. So, shotgun intermediate range. Shotgun intermediate range. So, the answer is intermediate range. Chalo. So, look at this image and try to memorize. So, shotgun ranges are classified into contact wound, close range, mid range, distant range. Contact range, that is round, close range you will see singeing, blackening and tattooing. Rat hole you will see mid range and intermediate range. In distant range there is no satellite wounds. Satellite wounds. So, answer is okay, fine. Chalo. Now, one more question from defense wound. Defense wounds can be active defense wound, passive defense wound. When defense wounds are seen over the palmar surface, when person try to grab the weapon. So, try to grab the weapon, that is known as active defense wound. So, in passive defense wound, a person protects himself from the wound. Like this, he will give a hand. So, here question is, so defense wound, antemortem wound, postmortem wound, hesitation cuts. So, hesitation cuts are seen in suicidal wound. Suicidal. Okay, especially in borderline personality disorder or histrionic personality disorder, attempt to commit suicide. Postmortem wound, there will be no vital reaction. No vital reaction. In antemortem wound, there will be vital reaction. Vital reaction. Defense wound can be active or passive. Active or passive. So, my question is, definitely it is defense wound. It can be antemortem as well. You can see over the palmar surface. Palmar surface. Is it active defense wound or passive defense wound? Try this. Active or passive? Come on, active or passive? See, vital reaction, Praveen, it is basically inflammation. So, when you see redness, swelling, so all the signs of inflammation, so that is nothing but vital reaction. So, vital reaction is a feature of antemortem wound. There can be elevated enzymes on histochemistry. So, antemortem wound. So, that is not the question here. The question is whether it is active or passive defense wound. Active or passive? Yes. So, this is the active defense wound. So, answer is active defense wound. Okay. So, look at this now image, this video. So, there is a sharp weapon there. So, when victim tries to grab the weapon, then it is active defense wound. When victim tries to protect himself by giving hand like this from the stab wound or incised wound, that is known as passive defense wound. Look at this now. Look at this video for better understanding. Look at this video. So, this is the video that is showing grabbing. So, when you grab, no, so there will be injuries over the hand, that is active defense wound. So, that is what I am explaining here. Praveen Prasad. Okay. And on the other side, on the back side, you can see, okay, that is known as passive defense wound. Okay. So, have you understood this video? Any doubt in this? Scared of uncle? Okay. Chalo. Any doubt in this? Any doubt? Okay. So, uncle is scary here. Uncle. Fine. Chalo. Next question is from heavy metal poison. See, heavy metal, one is either arsenic poison, lead poison, mercury poison, copper poison, thallium poison. So, anything that can be asked, toxicology. Arsenic though very commonly asked. Lead very common. So, heavy metal poison must know topic in forensic toxicology. 56-year-old man having pallor. So, pallor because of anemia, vasospasm. Exhaustion because of the weakness. Patient is having stomach pain, abdominal pain is a classical feature of lead poisoning. So, he is having memory issues, he is working at battery recycling facility, battery. So, most of the batteries, no, they are made up of lead. So, examination reveals both the lower limbs have substantial food drop because of the involvement of the nerves, peripheral neuropathy, motor neuropathy. So, blood levels are elevated according to laboratory test. Which enzyme is impacted by the situation? So, it is basically lead poisoning. Lead. So, lead is going to affect the heme synthesis. Heme synthesis. How heme synthesis? By two enzymes. What are they? ALA dehydratase and one more enzyme. Can anyone answer? What is the one more enzyme? What is the one more enzyme? Very good, Sanvi. Ferrochelatase. Ferrochelatase. So, these two enzymes are affected in case of lead poisoning. So, there can be normocytic normochromic anemia or there can be microcytic microchromic anemia. There can be Burtonian line. Remember motor neuropathy in lead poisoning. So, can anyone answer what is the route of entry of lead into the body? Common way of entry of lead into the body, that is basically inhalation. So, lead में inhalation है. Inhalation is the route of entry और arsenic में water. Arsenic, water, lead, that is inhalation. So, yes, all paints, everything you must know. Inhalation, correct answer. Yes, good. Pratiksha, good answer. So, answer is A. A is the answer. So, you must know these findings very commonly asked: A, B, C, D, E, F, G. A for anemia with a basophilic stippling, B for Burtonian line, C for constipation, colicky pain, wrist drop, foot drop, E for encephalopathy, facial pallor, there can be gout, and there are Burtonian lines. So, all these are very commonly asked. Can anyone answer what is the compound responsible for Burtonian line? Burtonian line. I said Bertolini line, which is non-specific. Non-specific. What is the compound responsible for that? What is the compound? Can anyone answer? Let's see who is going to answer. Very good, Shivam Garg. Shivam, excellent answer. Shivam, very good. It is lead sulfide. Lead sulfide. Lead sulfide. Good answer. Good answer. What is the enzyme that is affected in basophilic stippling? So, what is the answer for this basophilic stippling? There is a basophilic stippling no in lead poisoning. What is the enzyme that is affected in lead poisoning? Let's make it interactive. Let's make it interactive. Yes, come on. Yes, Doxab, very good. Doxab, Dr. Saab, very good. 5' nucleotidase. 5' nucleotidase. 5' nucleotidase. Good answer. Chalo. Next in arsenic poison. So, in arsenic also very important. In arsenic you will see meese line, that is whitish line over the nails. So, Aldrich meese line. Then in arsenic, R for raindrop pigmentation. Raindrop pigmentation, red velvety mucosa. Subendocardial hemorrhages. Black foot disease. Neuritis. We use BAL as a treatment. Cholera-like illness. So, one of the very important finding is raindrop pigmentation. Raindrop pigmentation. Raindrop pigmentation. So, this is very important. Very important question. Arsenic. So, one more question here. Meese line is seen in some other poisoning. See, meese line is not classical of arsenic poison. It can be seen in some other poison. Can you tell me what is that condition where meese lines are seen other than the arsenic poison? So, in arsenic there is a mixed neuropathy, can be asked. Yes, very good. So, thallium poison. Thallium poison. Excellent answer. So, the answer given by again Doxab and Karthik, Shivam Garg and Ram. Good answer. And this BAL is contraindicated in. So, asked in recent exam. So, BAL is contraindicated in. So, can anyone answer? BAL is contraindicated in. Peanut allergy. Okay. Iron poison. Cadmium poison. Organic mercury. Okay, organic mercury. Mnemonic is PICO. PICO is a mnemonic. So, all of you write PICO is equal to BAL. So, write this in chat box. Yes, Doxab, you just write PICO. So, this can be asked in the exam. Come on, keep writing PICO. PICO is equal to BAL. Pratiksha, good. Ram, good. So, all of you write. This is very important, very commonly asked. That's why I am asking you to write. Okay. All of you write. Pratiksha, Ram. Yes, MP Virtus Pico ball. Very good. Pico ball. Come on, Pico ball. Sanvi, good. Doxab Pico. Good. You are the best, Doxab. Doxab, you are best. Good. Pico ball. Very good. Okay. Abhishek Singh. Pick ball. Okay. Pico ball. Beka. Okay. Karthik. Very good. Dr. Gulam MBBS. Gulam. Very good. Chalo. Next. Next question is about consent. Consent. Meeting of minds. My mind, your mind. Okay. Meeting of minds is consent. As per Indian Contract Act, Section 11 of 1872. So, what do you mean by consent? Consent can be oral consent, verbal consent, written consent. So, after being informed the advantages risk of hysterectomy, a 45-year-old female patient consent to treatment. What sort of authorization is this? So, here surgery. So, for any surgery, it should be written consent, written informed consent. So, you must tell about the diagnosis, treatment hysterectomy, complications of hysterectomy, and also future treatment options. So, this is informing everything and taking consent from a patient of age more than 18, known as informed consent. So, this must be informed consent. Informed consent, A is the correct answer. Implied consent, basically patient behavior. So, patient is waiting for you, patient is waiting for you in the clinic. That implies that he or she are willing to undergo general physical examination. It is a patient behavior and patient mannerism. Okay. Blanket consent, one consent, all procedure at the time of admission. That is invalid, that is illegal. Oral consent, no. Oral consent is very risky. It should be written consent in patient own language, in presence of two witnesses. That is important. Okay. So, what is the consenting age for surgery and what is the consenting age for medical examination? So, my question is medical examination, what is the age? What is surgery, what is the age? Surgery or sexual intercourse or organ donation, what is the age? So, we call it as statutory rape when age is less than. Can anyone answer? Medical, what is the age? Yes, Sanvi, very good. Medical, it is 12. Surgery, it is 18. Statutory rape also 18. Now, I have a question for you guys. So, I have a question, husband and wife. Husband and wife. Husband and wife. So, wife age is 17. So, having intercourse with the wife by husband in some cases of child marriage, definitely child marriage is a punishable offence. Is it rape or not a rape? So, here question is not that simple. The question is husband, wife age less than 18, maybe 17 and a half. Some rare case of child marriage, having intercourse with her by husband. When case is filed by the wife within 1 year after the occurrence of the intercourse, is it rape or not rape? Is it rape or not rape? Sangeeta Reddy, Shauryam Gupta, Hazel. Hazel, what is the answer? Come on, answer. So, it is rape. It is rape basically. It is actually statutory rape with or without consent, but case should be filed within 1 year. Within 1 year case should be filed. Say example, the rape happened, intercourse happened somewhere in 2023. 2023. The case is filed in 2025. So, happened in 2022, 2023. Case is filed in this July. Is it rape? What do you think? Is it rape? So, my question is husband and wife. Husband and wife. So, intercourse happened in 2022. The case is filed with the wife in 2025. That time she was 17, now she is 20. What do you think? Is it rape or not a rape? Come on, try. Sanvi. Yes, come on. Okay, chalo. So, it is not rape. According to Supreme Court, case should be filed within 1 year, within 1 year of occurrence of the incident. Yes, chalo. Good. Next question is from thanatology, postmortem changes. very important topic. Relaxation of sphincter, marbling, adipose hair, liquefaction. See, relaxation of sphincter occurs immediately, okay? It occurs immediately within 24 hours. Immediately occurs. So, there will be, there can be defecation, there can be urination. So, sometimes there can be, seminal stain at the site of the crime. So, all because of relaxation of sphincter. So, that is basically in case of somatic death, basically immediate death. So, within 24 hours. Marbling, see, marbling is basically, marbling basically 1 to 3 days, basically 48 hours, 48 to 72 hours. So, adipose hair, the minimum age is around 5 to 10 days. So, this is basically C. So, liquefaction, that is 1 to 2 weeks, 5 to 10 days, 5 to 10 days. So, what is the best answer then? A4. So, only one option with A4, B3 and C1, liquefaction, A4. So, here none is the answer, right? None is the answer. C, okay, C is partly correct. B, 1 to 3 days, marbling, yes, 1 to 3 days, correct. So, this is the correct answer. C, good, good answer, good. Now, look at this image. What is this known as? What is this visible veins over the body? What is this known as basically? This is known as marbling. Marbling. Chalo. Next is drowning. Drowning. Very commonly asked in the exam. Sometimes seawater drowning, sometimes freshwater drowning. Repeatedly asked. Okay. Seawater drowning. See, try to understand seawater. Seawater, there is more NaCl. More NaCl enters into the lung. So, there is a more NaCl in the lung. So, when there is more NaCl in the lung, so there will be hemo concentration. So, there will be small orifices. So, there will be hypernatremia. As you know, so hypernatremia opposite hypokalemia. So, the combination is hypokalemia, hypernatremia. So, what is the best answer then? So, there will be hypernatremia, there will be arrhythmia because of the decreased volume load. So, and there can be anoxia induced, hypoxia induced arrhythmia can be seen. Then there can be hypokalemia. So, what is the best answer then? 2, 3, 5. I know. So, seawater there will be hypernatremia, 2 and 3 correct, 2 and 3. So, what is the best answer? Best answer C, only 3. So, answer is only 3 only. So, its best answer 3, but anyway, don't worry, try to understand the finding. So, in case of seawater, there will be hemoconcentration. In hemoconcentration, there will be hypernatremia, hypokalemia, and there will be hemoconcentration. So, myocardial anoxia and the death. So, try to understand this. Okay, yes, fine. Now, one very important question, guys. Look at this. Now identification, commonly asked. I have a skull here. Say hi to our guest here. Say hi to our guest. Can you able to see? Yes, come on, guys. Look at this. This is actually a gentleman having steeper forehead, frontal eminence, parietal eminences are small. Say hi. Okay, hi. Okay, so good, thank you. So the question is now about the hello, good. So good. Now look at this. So I think you can make out. So steeper forehead. So whenever you see steeper forehead, that is male. Straight forehead, that is female. Look at this now. This image, I think, for better understanding. straight forehead, straight forehead, okay, female, basically it is female skull. And look at the frontal eminence and parietal eminence. So, frontal and parietal eminences are prominent in female. This is one very commonly asked question. Frontal eminence and parietal eminence, they are prominent in female skull. They are not prominent in male skull. Rest all are prominent in male skull except this frontal and parietal eminence. Now you can see here identification feature of female skull. Okay. Come on guys. So, smaller smooth mastoid, yes. Smooth glabella, yes. Round margin, that is also true. Zygomatic bone prominence, no. Heavy mandible, no. So, the best answer is 1, 2, 3, 6. So, answer is B. So, B, I think first to answer is by Karthik. So, Karthik, very good. Karthik, good answer, 1, 2, 3, 6. Now, look at this now image, try to identify which is male and which is female. It's a very nice image. It is showing you, look at the orbit, look at the orbit, look at the steeper forehead, straight forehead, U-shaped mandible. You can see here U-shaped mandible, U-shaped mandible. So, what is this, male or female? This is A, say example, this is A, this is B, this is A and this is B. So, can I try now? Can I try guys? A and B. So, left is male, right is female. Docs are very good. Left is male and female. Good answer. So, good. So, can anyone answer what is the best suture for the age estimation? Best suture. You know, we have sagittal suture, coronal suture, lambda suture, metopic suture. What is the best suture for age estimation with the help of skull? Okay. See, I said, I think Pratiksha, the sex determination is not based on one criteria. It is based on multiple criteria. So, there are 10 plus, there are many criteria. Sometimes what happens, there can be some criteria which are not matching with the opinion. Okay. So, it is basically collective opinion, not based on one opinion or one finding. Okay. Sagittal, very good answer is sagittal suture. Sagittal suture is the best suture for age estimation, can be asked in upcoming NEET PG exam. Okay, yes. U-shaped mandible male, V-shaped mandible, that is in female. Frontal parietal eminence are prominent in female. Mastoid process, everything that is prominent in case of male. Okay, good. Now look at this video, all of you identify whether it is a male or female video. Female sacrum. Look at this now, identify this video. I am just asking you a question here, male or female? Identify this. See, sacral promontory prominent. The ala, they are bigger. In case of female, there will be forward, lower half, lower half of the sacrum. So, that will be inclined towards you, inclined front. So, it's somewhat straight here. If it is inclined, then it is basically a female sacrum. So, what you can see here is the sacrum. So, median crest, intermediate crest and lateral crest, auricular surface, sacral promontory, sacral vertebra and all. So, again differences between male and female sacrum, male and female pelvis, very important. So, all this you must know. carbobasal index, okay, all this. Carbobasal index is male less than in 42 in females, that's good. Carbobasal index, okay, good, chalo. Now the next question from lightning. So very simple question. What is the shown below? Look at this now. This looks like a tree appearance. So tree appearance, hai na? It looks like a fern tree. Fern tree. So it is basically filigree bun. Filigree bun. It's also known as arborescent marking. Arborescent marking. It's also known as Lichtenberg flower pattern. So all are same. All are same. So you can remember lightning is equal to fall. Fall. F for filigree, A for arborescent, L for Lichtenberg, fall. So all of you just write the mnemonic in the chat box. Lightning is equal to fall. Write this in chat box. Mnemonic is fall. So whenever question asked marbling, that is 48 to 72 hours. Postmortem staining, that is a very important topic. That is not the answer. In carbon monoxide poison, you will get cherry discoloration. That is not the answer. So marbling also not the answer. Answer is filigree bun. So lightning is equal to fall. Fall. What is the cause of death? Answer is ventricular fibrillation. So most common cause of death is ventricular fibrillation. It can be respiratory paralysis and other causes as well. So okay, yes. Now comes is very nice picture that is showing freshwater drowning. So look at the well there, very nice well. So my question is, what is not seen in freshwater drowning? Fresh water means that is sweet water. So fresh water enters into the lungs. So there will be hemodilution. When hemodilution, up to some extent it can dilute, RBC can swells up. After that they can lyse, RBC lysis. When RBC lysis, potassium comes out, hyperkalemia, hyponatremia. So what is the best answer then? Hemodilution, yes. Hyponatremia, yes. Arrhythmia, yes. Hypokalemia, wrong. So the person dies within 5 to 6 minutes. Okay. In case of seawater drowning, he dies in around 10 to 12 minutes. Again, depending upon the levels of the potassium level. So basically, it is more in case of in seawater drowning. So we use Gettler test. Now Gettler test is outdated. That is not used nowadays. Gettler test. Yes, is it clear? Hyperolemia also seen. Yes, Doxa, you are right. There can be hyperolemia. Hyperolemia is seen in both freshwater and seawater in both the condition. So in case of freshwater, hyperkalemia leads to ventricular arrhythmia and death. In case of seawater, myocardial anoxia. So because of the hemoconcentration, myocardial anoxia, that can lead to arrhythmia and death. So in both the condition, it's arrhythmia only. So can anyone answer what is the cause of death in dry drowning? Dry drowning, very, very commonly asked. One more, what is the cause of death in hydrocution? Hydrocution and dry drowning, both. Yes, very good, Sanvi. So dry drowning, it's basically a laryngeal spasm. Hydrocution, basically ventricular fibrillation, that is a cold water drowning. Secondary drowning caused by secondary infections like pneumonia, meningitis and all. Secondary drowning. Okay, near drowning is also same, secondary drowning only. Okay. Yes, good. So, hydrocution basically vasovagal inhibition, correct, vasovagal inhibition. So, that can lead to cardiac arrest. Yes, it's vasovagal inhibition, not the ventricular fibrillation. You are right. So, vasovagal inhibition. That's great. Good. Shaurya Gupta, good answer. So, next question is from strangulation. So, manual strangulation. A 22-year-old female with a hemorrhage in the eyes, neck, bruises. So, what we can see here, okay. So, you can see here somewhat sixpenny bruise. You can see here this is thumb. So, this is thumb. This is other fingers. So male or female. So, doing throttling here, throttling. So, this is present on the left side. I think probably one hand is used here, not both the hands. In both the hands, when they are used, both the hands like this, there will be sixpenny bruise on both the sides of the neck. But here one hand is used, that is why the fingernail marks are basically sixpenny bruise are on the only one side. So, all is a sixpenny bruise. So, sixpenny bruise basically it is throttling. Throttling, correct answer. Throttling. Good. Now, next question, very interesting question asked in NEET PG. Two friends consumed alcohol. So, consumed alcohol, they are friends basically. So, after which they fought for common girlfriend. This question asked in exam. Common girlfriend. So, one girlfriend, two friends. One of them pushes the other onto the floor, covers his face and nose like this. Face and nose like this. That is known as smothering, homicidal smothering, and also sitting on him over the chest, that is basically known as traumatic asphyxia. So, there is a combination of two, traumatic asphyxia and homicidal smothering. So, in this question you can see smothering, you can also see trauma there, traumatic asphyxia. So, what is this known as? This is known as famous method followed by William Burke and William Hare. So, they used to invite beggars, they used to invite friends to their houses, they used to give alcohol. Then Burke used to sit on the chest and used to do homicidal smothering, and Hare used to pull the dead body or pull the body around the room. They used to supply dead bodies to the medical college. So, it is known as body snatcher syndrome. You must be knowing body snatcher syndrome, that is nothing but infamous method of burking. So, the answer is burking. So, can anyone answer what are the features of traumatic asphyxia? What are the features of traumatic asphyxia? This can be asked. Traumatic asphyxia. Three findings are very common. So, what are three findings in traumatic asphyxia? Yes, it is known as mass ecchymotica, that is correct. Shivam Garg, you are right. So, what are the features? Let us see who is going to answer. I will give you some 10 seconds time. You just answer, try to answer. Try to answer. Yes, there can be deep cyanosis. Deep cyanosis. Deep cyanosis at the site. And there will be hemorrhages. So, there will be petechial hemorrhages. PH, petechial hemorrhages. And there will be clear line of demarcation. Clear line of demarcation. Clear line of demarcation between the affected area and non-affected area. You will see clear line. So, this is the triad of mask ecchymotic or traumatic asphyxia, deep cyanosis, petechial hemorrhages, clear line of demarcation. All these are the features of traumatic asphyxia. There can be subconjunctival hemorrhage, you said, yes, good, good. So, that is right, congestion and all seen in any asphyxia, but in traumatic asphyxia you will see these three features, very important. Following is used to identify vaginal cells and gland penis during examination of accused of rape. So, already we discussed, right, Lugol's iodine. So, up to 4th day, it is positive up to 4th day. It is because of glycogen in vaginal cells, okay. Precipitin test basically for species. Toluidine blue basically for micro injuries. Florence is basically for seminal stain. So, the best answer is Lugol's iodine till 4th day, yes. So, next question, very, very important question. All of you, very important question, very commonly asked. Pricky poppy. So, we call it as pricky poppy. So, whenever word pricky poppy, poppy punya, okay. So, poppy pricky. So, what is the best answer? Tulasi. Poppy word is there now, that is basically epidemic dropsy, okay. So, the answer is epidemic dropsy. So, that is nothing but Argemona mexicana. What is the active principle of Argemona mexicana, which causes epidemic dropsy, which causes edema, bilateral edema, which can lead to ascites, which can lead to glaucoma, which can lead to some other complications, right. So, what is the active principle of that? Nerium odorum. So, Argemona mexicana, try to remember, it is sanguinarine. Nerium odorum is basically oleander. Nerium odorum, Cerebera tivacea. One more is there, Cerebera tivacea. So, I will make a song for you, you just listen. Oleander means cardiac poison. So, how to remember? Nerium odorum, Cerebera tivacea. So, it is nothing but cardiac poison. They cause cardiac arrhythmia and death. Nerium odorum, Cerebera tivacea. Is it fine, guys? Is it fine? Is it okay if I teach you like this? You don't mind, right? Come on, guys. Come on. Nerium odorum, Cerebera tivacea. Pratiksha. Okay, Sanvi. Okay, fine. Now, Papaver somniferum, that is opium plant. Papaver somniferum is opium. Poppy seeds, they are not poisonous. Poppy seeds are not poisonous. So, poppy plant is opium, that is Papaver somniferum. Calotropis basically organic irritant. Calotropis used in artificial bruise and criminal abortion. Calotropis procera, Calotropis gigantea. Question asked in exam, gigantea, gigantin is the active principle of Calotropis. Okay, Calotropis. Yes, come on, chalo, this is okay. Chalo, okay. Now look at this. This is very important. 3 important diseases. So, one is neuroletheriasis, epidemic dropsy, endemic ascites. Pakka question in upcoming exam. One question will be there from this. Neuroletheriasis by beta oxalyl aminoalanine, caseridol. Caseridol. It causes neurolithiasis. So there can be different types of lithiasis. Osteolithiasis, vascular lithiasis. So one common one is neurolithiasis, single stick, double stick, crawling stage and death. Caseridol. Epidemic drug, I said sanguinarine, Argemona mexicana. Endemic ascites, hepatotoxicity, that is caused by pyrazolidine, and the plant name is Crotalaria seeds. Crotalaria seeds. So this you have to memorize. So all of you guys, okay, this is very important. Very important. If you want, you can take the screenshot or else, okay. This is very important topic, very commonly asked in the exam. Yes guys, are you enjoying forensic class? Is it worth to attend? So I am covering everything, all important MCQ asked in NEET PG. Are you enjoying class? Okay, neurolithiasis, BOA, beta oxalyl aminoalanine, adulterant caseridol. Epidemic drops is sanguinarine, Argemona mexicana, that is oil. And pyrazolidine, that is a toxin for endemic ascites, which is a hepatotoxic. The plant name is Crotalaria. Crotalaria. Yes, fine. Next. When victim is dying because of unlawful act. Okay, it's basically from evidence. You know, evidence can be direct evidence, indirect evidence, or it can be hearsay evidence. So this is basically medical evidence or the evidence. When a victim is dying because of unlawful act, the police recorded dying declaration. The doctor certifies that victim is conscious. Okay, so this is known as compos mentis. Compos mentis. So you can ask simple question in dying declaration. In dying declaration, you can ask simple question. What is your name? My name is Dr. Manjunath. So where are you staying? I am staying in Karnataka. 2 plus 2 is equal to 2 plus 2 is equal to sir 4. So that means compos mentis is normal, mentally oriented. Under what circumstances dying declaration is invalid? Invalid. That means no use, nothing, invalid. If the victim is not dead, definitely. Our victim didn't sign the declaration. Declarant not expecting death. It is done by the doctor. Invalid. So what is the best answer? Yes, so logical answer is victim is not dead. It's of no value when victim is not dead, but it has some value only, that is known as corroborative value. So most probably it is the correct answer. But remember, in dying declaration comes under BSA. Can anyone answer what is the section of BSA for dying declaration? Dying declaration, previously it was 32 Indian Evidence Act. 32 Indian Evidence Act. Now it comes under different BSA section. What is that section? BSA 32 Indian Evidence Act, that is previous. Indian Evidence Act is now outdated now. My question is, what is the section of BSA that corresponds to dying declaration? So this is not the answer, okay. And in dying declaration, no oath. No oath. No cross examination. No cross examination. Okay. Any person can take. Any person. In presence of one or two witness. It can be video recording also. Video recording also can be a dying declaration. Suicidal note also can be dying declaration. So okay. So when it is recorded by the magistrate, it is have more value. It is followed in India. So what is that? 26A. Very good. 26A is the correct answer. This can be asked in exam. So dying declaration comes under 26A. So no oath, no cross, any person. So this all three are question asked in the exam, followed in India. So there is something known as, look at this now. This is very interesting image. Very interesting image. What we can see here, this is the victim. So victim is there. Victim of some offense, maybe murder or rape or any offense. Then what you can see here, magistrate. So, magistrate, and he is basically magistrate, and he must be advocate, and he is the accused, in presence of doctor. So, this is bedside court. So, this is known as bedside court or court by bedside. So, this is followed in US, followed in UK and other countries. So, what is this known as? So, this is not followed in India, this is known as dying deposition. So, dying deposition. So, dying deposition is superior than dying declaration, because it is the statement that is recorded by the magistrate, only by magistrate. Remember, in dying deposition only by magistrate, in presence of accused, in presence of advocate of the accused, in presence of doctor, basically to check compos mentis. So, this is known as dying deposition. It is legally superior than the dying declaration. So, all of you write dying deposition is equal to court by bedside. Write this in chat box. Dying deposition is equal to court by bedside. Come on, try. Okay, court by bedside. Okay. Next. Good. All of you try to answer. Okay, Pratiksha, very good. Sanvi, good. Gulam, very good. Gulam. So, next question. So, a 14-year-old girl was kidnapped by male. While police arrested him, he died in the police custody, inquest conducted by. So, it is a custodial death. So, when custodial death, it comes under 196 BNSS. So, it is basically not the coroner, not the police. So, judicial magistrate. Most of the time it is judicial inquiry. So, judicial magistrate. So, one of the indication for judicial inquiry into the cause of death, investigation into the cause of death is death in police custody. Death in police custody, magistrate, 196 BNSS. Now, the snakes. So, commonly asked snakes question. Look at this snake. So, in this snake, okay, you can see the white color transverse line. So, white transverse line, and also you can see the neurotoxicity there. So, neurotoxicity, steel black in color, fatal dosage is 3 to 6 milligram. Signs and symptoms resemble like stroke, very poisonous and very cunning snake. It has a tendency to bite people in their sleep. So, it's a very cunning snake, like Katappa. You know Katappa character? Katappa is a very important character in Bahubali movie. Cunning snake. It has a tendency to bite people in their sleep without any stimulus, and convulsions are very minimal, but the paralysis is very prominent. Cunning snake, Katappa. What is the answer, all of you guys? So, what is the Katappa? And okay, so this must be a common crate. So, fatal dose is 3 to 6 milligram. So, it basically comes under Elapidae. Elapidae. So, coagulopathy no, renal failure no, shock no. So, more of respiratory paralysis. So, answer is B, respiratory paralysis. So, vipers are hemotoxic, very commonly asked. Russell's viper, saw-scaled viper, hump-nosed viper, pit viper, all vipers are basically, so they are basically hemotoxic. They cause DIC, disseminated intravascular coagulation. Sea snakes are myotoxic. Okay. So, the treatment is anti-snake venom, anti-snake venom. If they ask you in exam, big four snakes in India, can answer anyone? Big four snakes in India? Big four snakes. What are big four snakes? Yes, come on. Big four snakes in India. So, big four snakes are basically common cobra, common krait, Russell's viper, saw-scaled viper, saw-scaled viper. Again, question can be asked about the scientific name. So, what is the scientific name of common cobra? Naza naza. Naza naza. Common krait, king cobra no, king cobra no. Common krait, Dubai Russelli basically for Russell's viper. Saw-scaled viper, Achis carinatus. Achis carinatus. Common krait, what is the scientific name? Can anyone answer? Yes, very good, Shivam Garg. It is basically Bungarus caeruleus. Bungarus caeruleus. Shivam Garg, very good, excellent, excellent answer. So, this is what question asked in the exam. Okay, chalo. So, the treatment of all these big four snakes is, that is anti-snake venom, ASV that is given, ASV that is given. Sea snake no beta, sea snake no, sea snake is not big four, sea snake is myotoxic, doesn't come under this. These are big four snakes, big four, ASV that is given. How to differentiate between king cobra and common cobra? Common cobra, you know, king cobra. One is the size, and the scientific name of king cobra is Ophiophagus hanna. So, it's big in size, one thing. Second, it has no spectacle mark. So, it has no spectacle mark in king cobra. King cobra, the death occurs within a few seconds because of the large venom that is injected, king cobra. Okay, so this is all question asked in the exam. Hood is there in the both. Hood is there in common cobra also, king cobra also. In both the conditions, they say hood is there. Hood. So then, next question is about the late changes of late postmortem changes. The order in this condition. So, what is this order in this condition? So, this is basically mummification. So, as you know, mummification. So, there will be orderless, right? Good. See, now look at these three images there. So, there are three images here. So, three images. So, what are these three images? Can identify what are these three images commonly asked? So, A, B, C. So, very commonly asked. So, let me discuss about this A, B, C. So, this is basically can see brown or black in color. So, brown, black in color. It occurs in high temperature area, high temperature, dry area, basically dry area. So, this is white, a whitish over the fatty areas, fat areas. So, it is somewhat offensive fruit odor, offensive fruity odor, or sweet odor, or ammonia odor. So, this is odorless, odorless. This is fruit sweet odor. So, it occurs in warm environment, warm humid environment. And look at this. So, this is somewhat greenish discoloration, green or black discoloration. So, what are these basically? So, the first one is as you said, mummification. Yes, this is mummification. Mummification. Second one is adipocere. Adipocere. And the third one is putrefaction. Putrefaction. So, good. So, the many they answered correctly. So, this is basically 3 images you need to memorize. Now, anyone, can you tell me what is the green color? There is a green color in putrefaction, no? So, the green color is produced by the substance. What is the substance that leads to green color? So, there will be marbling, green color over the right iliac fossa, undersurface of liver, blood vessels. All is green color because of what? It's all because of Clostridium, Clostridium bacteria, right? Sulf hemoglobin. So, this is basically sulf meth hemoglobin. Sulf meth hemoglobin. So, this is one asked in the exam. So, can anyone answer medico-legally, which is having more importance, or say which can preserve the facial features? Facial features are well preserved in. The question asked, facial features are well preserved in. So, what is the answer? So, look at the answer. So, facial features are well preserved in. Look at this. So, what is the answer, guys? So, mummification. So, facial features are well preserved in mummification. You can make out the injuries over the body, you can make out the facial features. But in case of adipocere, you can make out facial features, but not that clearly. But in case of putrefaction, facial features are totally distorted. So, totally distorted. So, this is asked in the exam. So, mummification occurs in hot, dry environment. Adipocere occurs in warm, humid environment. Putrefaction occurs in normal temperature. Most common putrefaction. Okay. So, this is about the question about the late changes. Late changes. So, this completes your all questions. So, if you have any doubt, you can ask me. So, I will be here for next 10 minutes. 10 minutes, guys. If you have any doubt, you can ask me. Any topic you want me to take, you can also tell me. You can suggest me, I can take. Okay, Pratiksha, okay. Some IPC, some BNS both. Some IPC, some BNS both. Anyway, IPC you know, BNS you have to memorize. Okay. Florence, Pratiksha, Florence is a test for seminal stain. In Florence, you will get dark brown rhombic crystals. They are choline iodide crystals because of the presence of choline in the prostatic secretion. Then Takayama test, See Takayama, in Takayama, I said mama, pink feathery crystals. That is for blood stain. Takayama, Teekman for blood stain. Okay. Florence is basically for seminal stain. Okay. And also Teekman also you will see brown rhombic crystal, and Florence also you will see brown rhombic crystals. So only difference in blood stain, so that is the more size. So okay, the more size in case of Teekman test. Teekman. Yes, any doubt you can ask me. Any doubt you can ask me. Now I have a question for you, some forensic mystery questions. So just for the interest sake, you just say, so yes or no. Let's see how many are going to answer. Okay, Doc Sab, what is your doubt? Angle of mandible. Beta, angle of mandible is less obtuse in males, more obtuse in females. Less obtuse in males, more obtuse in females. Please tell about the order of court in Indian system. Okay. So tell some important BNS. Okay, important BNS. Chalo. So let's start important BNS. Okay. So BNS, there is a video in BNS. I'll just share with you in the group. Are you there in PW group, right? So you are there in the PW group, right? So it takes some time. It takes around 45 minutes to teach that. I'll share those important questions in group. Is it okay, Pratiksha? So BNS I'll share with you. Sanvi, Telegram group I'll share with you. So play about order of court in Indian system. Order of court in Indian system. So basically Supreme Court, then comes his High Court, then comes his Session Court, and additional Session Court, Assistant Session Court, then comes his First Class Magistrate Court, Second Class Magistrate. So the question can be asked, what is the power of Session Court? So what is the power of Session Court? So Session Court can pass any sentence. Additional also can pass any sentence. I think this question is from Somi Ghosh. So Ghosh, so your question, any sentence. Assistant Session Court maximum 10 years of imprisonment. So every court has a power. So Assistant Session Court has a power of maximum 10 years of imprisonment. It can pass a sentence up to 10 years. But now it is abolished. There is no Assistant Session Court in India right now. So that is not mentioned in BNSS and BSA as well as BNS. First class magistrate 3 years and 50k fine. Second class magistrate 1 year 10k fine along with community service, community service. That means unpaid work as a punishment, like cleaning public garden, cleaning public toilet, something like that. Okay, yes. So that is about the, okay, next Doksab, your question, Doksab. So Doksab question is, what is the order of opening the cavity? No, yes, fine. See, in case of Doksab, in case of hanging, neck is opened at last. So we usually open head, then thorax and abdomen, then lastly thorax and abdomen. So after that neck at last. In air embolism, the head is opened first. In case of any poisoning, the head is opened first. Okay. So again, if say any injury over the abdomen, then all other cavities are opened and finally the abdomen is opened. It depends on the case. Okay. So lowest court for death sentence, additional session court. The question from Somi Ghosh. So death sentence can be passed by either by High Court, Session Court, Additional Session Court. So Additional Session Court is the correct answer, not the Assistant Session Court. Okay, any other question? Dok Saab ho gaya, Ghosh done. Then any other question from your side? Okay, Dok Saab, you can go. Any other doubt? Okay. Okay, that's fine. That's fine. Okay, Shivam Garg. Thanks for your feedback. Okay, Ghosh. Age determination through the bones. Okay. Again, this is important question. This just remind me in the Telegram group. I'll share a video with you. It takes around half an hour. So teach all the bones, basically radius, ulna and all, you know. So it's very interesting and very important as well, especially carpal bones, elbow and shoulder and all. So this I'll share a video with you. Okay. Okay, Gulam Das, thank you. Thanks for your feedback. Gulam MBBS, wish you all the best. Do very well in upcoming exam. Singarapu Karthik, thank you. Vidyananda, I'll help you, don't worry. We are there to help you. We as a team of PW MedEd, we are there to help you. Pratiksha, thank you. Somik Ghosh, wish you all the best. Wish you all the best. Yes, Dr. Tulasi, welcome. I hope you enjoyed this session, 2-hour session. Some fun in between. Vidyananda, okay. Sanvi, are you there, Sanvi? Where are you, Sanvi? Abhishek Singh. Abhishek, you will definitely, you will definitely, don't worry. Abhishek and Sanvi. Yes, thank you all and wish you all the best for upcoming exam. If you have any doubt in forensic medicine and toxicology, you are free to ask in Telegram group, and we are there to help you as a team. Thank you. Wish you all the best once again.